Our third track is trauma-based. So we deal with both acute trauma and complex childhood trauma. And that would be physical, emotional, sexual abuse and neglect. And probably as likely as not, most of our patients have trauma-based issues regardless of their presenting problem. So I think one of the really wonderful things about Harmony Place is that all of our clinicians are trauma informed. We don't just have one specialist that kind of deals with that. The whole team is specialized in incorporating a trauma approach regardless of what the presenting problem is.
Well, a lot of places these days say they do trauma work. And we have been doing trauma work now for 30 years. And so the aspect of trauma work that's important is not that just people talk about what happened to them, but that in addition to that, you understand that there's this unfinished business is a lot like doing grief work. And it's as if the brain gets stuck at the place of T-1. And so it feels to them like it just happened yesterday. And so you might compare it to, let's say, a time in your life when something terrible happened and your grandparent died or something of that sort. And for some people, it's just they can't ever be the same because they're in so much pain around that experience. And so they talk to their friends about it, they write about it, they try to grieve it, but they get stuck in that grief. Well, trauma work is a lot like grief work. It means that the brain is kind of stuck at that at some level. And so in the treatment model, what we understand is a person gets stuck at sort of T-1, T being the trauma, and some part of them gets stuck in time. So we go back and help them retrieve that part that's stuck and help that part begin to talk about what happened from the vantage point of how they experienced it at the time. And so they integrate the memories and the feelings, and then they identify what we call the stuck points, or what get them stuck in some way. Sometimes it's what caused it, sometimes the regrets they have, they should have done this, they should have done that. Sometimes they blame themselves, I'm a bad person, something of that sort. So whatever the stuck points are, that's what keeps them at that point in some way. And we help them begin to talk about those stuck points and look at it from a rational standpoint. And so oftentimes there's regrets and resentments that they have, and they have to have an opportunity to be able to identify those and eventually work through them to be able to move on from the trauma.